For me, the story begins back around 2000, the late 1990s, actually, when Scott Shannon, Lou Vanderveer, Janet Settle, and a couple of other colleagues and I would meet every couple of months for peer support and clinical growth in the area of integrative psychiatry. And that really is a very important part of the integrative psychiatrist, integrative mental health practitioner's journey, and one of the important elements that Keith and Will have included in this IPI fellowship. Scott would mention this out-of-the-box product called Empower Plus, and he was very impressed with it. And he told me how it had been transformative for some of his most difficult-to-treat patients, and would encourage me to, look into it. And it wasn't until 2004 that I treated my first patients with the product available at that time from True Hope, Empower Plus, and I haven't looked back. Julia Ruckledge and Bonnie Kaplan have really done a lot of work, not only in the clinical research, but in helping to establish the nomenclature and the parameters. It's so important for any treatment modality, so that we know what we're talking about, we can communicate, and the research can be compared and built upon. It's important then to distinguish a multi-ingredient formula product from that which is not. And so it's somewhat arbitrary, but important for research and clinical practice that, if the product has 3 or less vitamins and minerals, it is not an MIF. Ayurvedic medicine or oriental medicine, those are other worlds. For those who are taking psychoactive meds, I mentioned earlier, we have the 2 groups. The standard medication group, which is typically reduced in increments of 1/4 of the starting dose, and then the so-called red flag meds, which are reduced at 1/8 increments. What are these micronutrients that constitute the majority of the ingredients in the MIF? For the most part, they're minerals and vitamins. They're not amino acids, essential fatty acids, hormones, and some of the other, very important nutraceuticals. And even though the formulas do include some botanicals, we don't consider them to be micronutrients. The relevance of micronutrients to mental health has been appreciated for, a century. And even in this modern era, we have the Institute of Medicine, issuing important policy and public health statements regarding nutrition causing or altering the course of a disease